One of my favorite supplements to recommend around the time of surgery is omega-3 fatty acids. Yet, this is one of the supplements that is still routinely told to patients to stop before surgery for risk of bleeding. Historically, omega-3 fatty acids were thought to potentially increase patients' risks of bleeding. We obviously don't want that. So it was told to all patients, and still is told to patients, that they should stop these medications or supplements at least 2 weeks before surgery. But there was a really nice meta-analysis which showed that fish oil actually didn't increase a risk of bleeding during or after surgery, or increase the risk of needing a transfusion. In fact, there's some data emerging that omega-3s might actually prevent blood loss and encourage clotting after a trauma like surgery. Now, why do I recommend omega-3s? I like omega-3s because they tend to be anti-inflammatory after surgery, and we do want to somewhat decrease inflammation after surgery. And the way it does this is it actually allows for the production of things called resolvins and protectins, which are lovely named signaling molecules, which help to, as their name implies, resolve inflammation. And that's really what we want after surgery. We want an allowed amount of inflammation to allow your body to start to heal, but we don't want prolonged inflammation. So we want to resolve it as soon as our need for that acute period of inflammation is over. So if you have an upcoming surgery, did your surgeon or anesthesiologist tell you to stop your omega-3s? If so, for how long? And if you have an upcoming surgery, would you consider showing your anesthesiologist or surgeon this article and see if they change their mind?